Good morning. Everyone, I think, knows who's here. To my far right, Dr. Malatras, Dr. Zucker. I'm technically a doctor also, but not really. Melissa DeRosa, Secretary to the Governor. Robert Mejica, Doctor of the Budget. Let's talk about today's numbers and where we are today. Total number of newly hospitalized is up from yesterday, but when you look at the three-day averaging of these numbers, the three-day average is down, which is good news. This is the three-day hospitalization rate. We tend not to look at any one day. Day to day, it's up somewhat, but if you look at the three-day average, it's moving down, which is good news. We talk about the apex, and is the apex a plateau? And right now we're projecting that we are reaching a plateau in the total number of hospitalizations, and you can see the growth, and you see it starting to flatten. Again, this is a projection. It still depends on what we do, and what we do will affect those numbers. This is not an act of God that we're looking at. It's an act of what society actually does. Change in daily ICU admissions is way down, and that's good news. The daily intubations number is down, and that's good news. The discharge rate is right about where it was. The bad news is 5,489 New Yorkers have lost their lives to this virus. That is up from 4,758. That is the largest single-day increase. And we talk about numbers, but that's 731 people who we lost. Behind every one of those numbers is an individual, is a family, is a mother, is a father, is a sister, is a brother. So a lot of pain. Again today for many New Yorkers, and they're in our thoughts and prayers, many people across this country. Why the discrepancy or the discordancy, number of deaths up, number of hospitalization dropping, the number of deaths, number of losses is a lagging indicator to the number of hospitalizations, right? What happens is a person goes into the hospital. If they're treated, most of them are then released, they're discharged. Some stay, some get put on a ventilator. The longer you are on a ventilator, the less likely that you will ever come off that ventilator. And that's why you're seeing the number of deaths increase, because these are people who came in at the peak. They were not successfully treated. They're on a ventilator. The longer you're on a ventilator, the less likely you come off the ventilator. New York is still the most heavily impacted state in the nation. New Jersey, which is on the curve a little bit behind New York, is suffering. And again, our thoughts and prayers are with them. I spoke to Governor Murphy of New Jersey today, and we talked through the situation and working on joint strategies, but our heart goes out to all of our neighbors in New Jersey, Michigan, California, Louisiana. In terms of how we're operating, how we're managing the situation. As we know, the hospital system basically is a three-legged stool. It relies on number of beds, number of staff, and the equipment. Number of beds, we have started with a system of about 53,000 beds statewide. We're up to about 90,000 available beds, so we have more than enough beds available. Staff has been a problem. Staffing, healthcare staff is getting sick. They're overworked, they're stressed, they're under great emotional stress. You know, think about these healthcare workers. You're working in a hospital, in an emergency room that's overwhelmed. You're worried about your own health. You then go home. You're worried about bringing a virus home if you're infected. At home is under stress, as every home is under stress. About 7,000 new staff have been hired from the pool that we have identified. These are retired healthcare workers who came forward. These are people from across the country who came forward. The state has a pool of potential employees. The hospitals hire from that pool, and they've hired about 7,000 to date. Equipment, that's the protective equipment, ventilators, where we are stretching and moving, but every hospital has what they need to date. And then we balance the patient load among all hospitals, so no hospital, single hospital or system gets overburdened. And that's a daily adjustment, which takes tremendous cooperation among all of the healthcare institutions. I thank them very much for what they're doing. And then we have the overload relief, which is the Javits Center, 2,500 beds, and the U.S. Navy Ship Comfort. The U.S. Navy Ship Comfort had 1,000 bed capacity. It was originally for non-COVID patients. What wound up happening was we don't really have non-COVID patients. Closed down society, there's fewer traffic accidents, crime is down. So the original plan, which was the Comfort would take non-COVID cases from the hospitals, didn't really work because the hospitals didn't have non-COVID cases. I called the president yesterday morning, asked him to speak to the Department of Defense to see if they would change it to COVID. The president, to his credit, moved expeditiously, called me back yesterday afternoon, said they would make the Comfort non-COVID. COVID. When they make that transition, the capacity of the ship comes down from 1,000 to 500 beds because COVID patients require a greater treatment area, more space, and therefore the capacity of the ship came down from 1,000 to 500. It's still a tremendous benefit. So between Javits and the Comfort, that's 3,000 beds, which is a welcome overload relief to the hospital system, which is already extraordinarily stressed. But I spoke to General Shaughnessy today, who we spoke through the Comfort and Javits. The Department of Defense has been fantastic, and the number of military personnel they have sent up here and how quickly they've sent up here, and this is a tough assignment to run facilities this large and to come up to speed and to be handling this many COVID patients in a new startup emergency facility. This is a really difficult undertaking, and they've really been fantastic, and I want to thank them all. And I want to thank the president for moving as quickly as he did. We're working on a tri-state cooperative. As I mentioned, I spoke to Governor Murphy from New Jersey. I spoke to Governor Ned Lamont from the state of Connecticut. We coordinated the shutting down, if you will, when we did schools, businesses, et cetera, because this really operates as a tri-state area. A lot of people who live in New Jersey, work in New York, or live in New York, work in New Jersey or Connecticut. So we talk about the tri-state area, which is true. And we try to operate to the best we can as that regional collaboration. And that has been working well for us on schools, on the economy, on healthcare issues. We have to start planning, restarting life. We're not there yet, but this is not a light switch that we can just flick one day and everything goes back to normal. We're going to have to restart that economy. We're going to have to restart a lot of systems that we shut down abruptly. And we need to start to plan for that. And I spoke to the governors, Governor Murphy and Governor Lamont, about coming up with a regional, metropolitan, tri-state approach to do just that. How do we, when we get to that point, which we're not at, but how do we restart our economy and get everything up and running as quickly as possible? My personal opinion is going to come down to how good we are with testing. You're not going to end the infection and end the virus before you start restarting life. I don't think you have that luxury. How do you start the economy back up? How do you start getting back to work as quickly as possible? It's going to come down to testing. You're going to have to know who had the virus, who resolved the virus, who never had it, and that's going to be testing. And that is an entirely new field that we're just developing now, right? New York State developed, a Department of Health developed an antibody testing regimen that Department of Health has approved for use in New York State. That has to be brought to scale, and the Department of Health is going to be working with the FDA to do just that. This tests the blood to determine whether or not you have the antibodies, which means you had the virus and resolved the virus. That's why you would have the antibodies for the virus. That would mean that you're no longer contagious, and you can't catch the virus because you have the antibodies in your system, which means you can get to work, you can go back to school, you can do whatever you want. But you have to have that testing, and you have to have that testing on a scale, right? You have 19 million people in the state of New York. Just think of how many people you would need to be able to test and test quickly. So the antibody testing is part of that. Also, rapid testing to determine whether or not you have the virus now exists. They have, quote unquote, 15-minute tests that are commercially available. But again, they have to be brought to scale. No private company has the capacity to bring those to scale. So I was speaking with Governor Murphy and Governor Lamont. We are interested in working with private companies that can actually bring this testing capacity to scale, and to scale quickly. Because again, if you have the antibody testing, that's part. If you can then test if a person is positive for the virus, and you can do it that day, and you can get those results in 15 minutes, that's also another way to get back to life and do it quickly. So we're very interested in that in New York, so is New Jersey, so is Connecticut. There are private companies that have these tests. Again, it's all up to scale. We're starting them in the state of New York, but we only have about a 50,000 person testing capacity, which is nice, but it's not of a scale that's actually going to make a large difference. So private companies that are interested in getting into this space and coming up to scale quickly, we are interested in those companies, and we're interested in investing in those companies, and they should contact us at Empire State Development Corporation. Also restarting life, the state budget, not just this state, but every state budget has been decimated by this situation. You shut down the economy, people aren't working, they're not paying income taxes, businesses aren't operating, so our budget just collapsed, right? Our revenues just collapsed. You want to restart the economy, you have to help restart the local governments, and that's going to be a federal act. I don't have the capacity as a governor, no governor does, to generate revenue in a positive way from an economy that's not operating. That is going to be a federal stimulus bill. There's no other way to do this. And it has to be a stimulus bill that actually understands you have state and local governments that have to be brought up to speed and functioning if you want to facilitate this restarting of the economy. Federal government passed some legislation. As I've said at the time, it was woefully inadequate from New York's point of view. We then have had some time to actually study the legislation. It actually gets worse when you read it, and it's not even what was represented to us initially. So I'm sending our congressional delegation a letter today saying the past legislation did good for the nation. I have no doubt, gave aid to a lot of people and places that needed it. but it was not fair to New York, and that has to be remedied in any legislation that goes forward. The last point, I know it's been a frustrating 37 days, but it's only been 37 days on the other hand. I know it feels like a lifetime. It's been so disruptive, so abrupt, so frightening, so disorienting, but it's only been 37 days, right? Everything in context and everything in perspective. I know it's tough to get up every day, and this is like Groundhog Day, living through this bizarre reality that we're in. It's even more difficult, I think, with the weather changing, and you feel the seasons changing, and it's getting nicer, and you start to open a new book of possibilities, and now the weather's getting nice, and I should be getting outdoors, and I should be doing this, and I should be doing this. I get it. But it's only been 37 days. And I started by saying those numbers of cases, that's not arbitrary. What we do affects the number of cases. Our behavior affects the number of cases. We're generating the cases. They're not descending on us from heaven, right? It's our behavior. So it's been 37 days. The 1918 pandemic that we talk about peaked in New York for 6 months. It came through in 3 waves, and it peaked for 6 months. 30,000 people died in New York during that pandemic. Why? They didn't react the way we did. They didn't know as much as we know today. They didn't have the same drug therapies. But we are changing the curve in that virus growth. You see that plateauing. That's because of what we are doing. If we don't do what we are doing, that is a much different curve. And that's what happened in the past. So social distancing is working. Well, you shut down all the businesses. I know. Well, you shut down all the schools. I know. But it is working. That's why you see those numbers coming down. If we were doing the same rate of interaction, those numbers would still be going up. So to the extent we see a flattening or a possible plateau, that's because of what we are doing, and we have to keep doing it. I know it's hard, but we have to keep doing it. And to the extent it takes an effort, remember at this time, it is about we, and it is not about me. I know what I would like to be doing. I would like to be going, it's motorcycle weather for me. It's time to get out on the water. It's time to go hiking in the Adirondacks. I get it. It's not about me. It's not about me. What I do will affect other people. It will affect my family. It will affect other people. It will affect people in those emergency rooms who are killing themselves every day to keep other people safe. I get infected, I will affect them. So we all talk about society and community and interconnection and interrelation and family, and life is bigger than us. Now is the time to live that, right? Now is the time to live that. So when you feel that need, I have to do this. It's not about me, it's about we and what's good for all of us. And my health is in your hands. And your health is in my hands. And the health of those healthcare workers and those first responders and all those people who have to show up to work every day to keep society functioning, we are responsible to them also. So to the extent it's hard, I get it. But maybe if we think about it through a different lens, a broader lens, safe, and we do that by staying at home, and we will get through this together. Questions?
Said yesterday that the comfort is meant to treat trauma patients and that they could isolate COVID patients in a small number. I know you said that they're going to be treating a smaller number of patients, but, will the ship be able to care for, even that number of COVID patients safely?
I spoke to General Shaughnessy, I spoke to the president, I spoke to the vice president, and I spoke to Northwell, who's helping manage the Comfort. When you transition from non-COVID patients to COVID, the capacity of the ship goes from 1,000 beds down to 500 beds, but it can treat 500 COVID patients adequately and safely, and that's what we're transitioning into operation now.
On the antibody test, like if
Dr.
the
Zerbe, you want to speak
FDA
about the
approves it
antibody test?
tomorrow, how long is it going to take you at any of your
So we have a test at our Wadsworth lab that we have developed. We're working to scale that up now. Over the course of the next week, we'll be able to figure out how many we can run. We're expecting to be able to scale that up, not just here in the lab, in our lab, but to get other labs to do as well. That's where we'll have to work with the FDA to get that approved.
The FDA has already approved some private antibody tests. Is there a way that the state can work with them, or?
So I think that antibody tests are you have to look at them. Some antibody tests measure the immunoglobulin G, and others measure the immunoglobulin M and G. The difference is that some suggest that there's a new infection occurring, that's the IgM, and others show that the infection's been around for a while. So it's important to make sure that the tests that we are measuring show that individuals had the infection, they aren't have the infection, and still have the infection. So it's important to make sure it's the correct test. Our test measures the immunoglobulin G, saying that they had the infection and it's resolved.
Did you get that? Yeah, neither did I.
Sorry,
Do that one more
explain.
time.
I got one more time. Thank you. So there's many tests that are out there that companies are making. There's two types of immunoglobulins. There's one that says the infection just is still there and you're starting to mount a response, which happens with any virus. And your body also makes an immunoglobulin after your infection is resolved, or it's developed, it's resolved. That's the one you want to measure. Otherwise, you may be measuring something which actually says you still have the infection in your body. So you want to measure the one that says it's resolved, and that's the one that we've developed the test for. Is that better?
Yes, that was good.
Thank you.
I almost understood that one. Mark?
Earlier today, this is very provincial. I know you're close to the Jewish
I'm very provincial, that's
but
okay.
I know that you're very close to the Jewish community.
Yes.
Earlier today, the Novominsker Rebbe passed away from coronavirus in Borough Park, and he's going to be buried later today. So this is like a right for a Buddha Israel says, stay away, should be small, but you know how people listen. I mean, this seems right for mass gathering. Is there anything that the state police or state government can do to make sure that people are held at bay?
I'm sure is Borough Park, Brooklyn, right? I'm sure the NYPD will be doing what they need to do. I made it clear yesterday that these social distancing regulations are not just pleas, they're regulations. You can be fined for it. We increased the fine to make the point that was serious. I'm sure the NYPD will be enforcing it. But also people have to understand. I understand religious gatherings. I understand the Orthodox community, Jewish Orthodox community. I'm very close to them, and I have been for many, many years, and my family's very close to them. But now is not the time for large religious gatherings. I mean, we paid this price already. We've learned this lesson. That was New Rochelle and Westchester. So please, now is not the time. You do no one a service by making this worse and infecting more people. Joseph?
There's been a lot of reports that communities of color have been particularly hit hard by the virus. Do you have a sense yet if that's been the case in New York? And you've been putting out a lot of data, gender, age, updating it daily. Has it been difficult to get those racial breakdowns? And what are you doing to get those?
So the hospitals actually don't report the race information directly to the state, so what we end up doing on the back end is calling the coroner's offices around the state after the death has been reported. So there has been a lag. We understand people want that information. We want that information too, and we'll have it this week.
Is there any sense, though, Dr. Zucker, that there has been that trend where it has affected communities of color work?
So one of the challenges is that some of the communities have challenges with their health in general. They're more apt to have some of the challenges with asthma and diabetes. And so anytime anyone who has underlying medical conditions ends up with this virus or any other virus, it puts them more at risk.
Do you have any update on the unemployment website? I know Felicity talked history about working with Google. Is there any progress there?
There is progress there, and we'll have that new interface up and running by Thursday. And we've actually worked with Verizon. A lot of the problem was the lines were crashing because the volume was so extreme. We've now moved 80% of the incoming calls off of the Verizon system and into call centers, and so you should start to see some easing up on that today. And again, we just ask people to remain patient as we get this resolved.
Governor, you promised an executive order on Friday regarding ventilator redistribution, and I believe that executive order was also going to cover other things. That still hasn't appeared. Is there a reason for the delay?
No, I'm going to issue an executive order today on everything that I've mentioned, the fines, et cetera, today.
What else will that cover? That will cover?
Everything we've discussed to date.
Some lawmakers have suggested that that's going to be voluntary now, the quote-unquote taking of ventilators, that the Health Association put out something saying it's going to be a voluntary taking of those. Is that how
Yeah,
you...
Joseph, it was always, the hospitals tell us what they have, quote-unquote, available, meaning unused, and they're not going to use it in the foreseeable future. So it was always of the equipment that you believe, you hospital believe is available, if the state lent 20% of the available units, as you define available, that would be 500. And 500 ventilators was a big deal, especially 2 weeks ago. Frankly, since then, other things have happened. We have 1,000 ventilators from China. California freed up 500 ventilators. Oregon sent 140 ventilators. State of Washington freed up, I think, 400 ventilators or something like that. We've also acquired an additional 500 ventilators. So we're not in the position that we were in. But that's what it always was. A hospital says we have available, by their own definition, unused inventory. We're not using for the foreseeable future. 20% of that number, leaving them with 80% of the unused, was 500 ventilators.
That sounds like a big change from what you were saying on Friday, though.
No, that's what I was saying.
Governor, what are your thoughts on getting a presumptive line of duty death benefit similar to that was passed after 9/11 for state and city workers who died of COVID?
It's something that I think is going to come up, and I think it's an important thing to look at. I'd also like to find a way to say thank you to these healthcare workers who are out there every day. You know, we talk to them on the telephone, but actually what they have done is just incredible, just incredible. And not just the healthcare workers. I mean, the healthcare workers, just think of the mindset to walk into that ER every morning, putting on these gowns, putting on all this protective clothing, having to change the protective clothing several times a day, seeing people pass away, and then go home and deal with the stress at home. But also the first responders, the transit workers. You look at the rates of sickness. I mean, they know what they're exposing themselves to, and they still do it. I mean, just God bless them.
Do you have plans to grant clemency to a large number of, or just any inmates in the state prison system to curb this corona outbreak?
We're looking at that, you know, any way we can, we are, and we're looking at that continually. I don't think there's anything new on that right now, but it's something we're exploring all the time.
Is there any specific plans that you're considering or any specific models?
We've done a number, but nothing right now. Are there any new?
We've done about 700 parole violators statewide. Those are people who were deemed to be low risk to public safety and also high risk to COVID. And so we have done that so far, and we're continuing to evaluate it on an ongoing basis.
I think the promise was about 400 people to come out of Rikers. So far, that's been about 130 people have been released. Is there a
I think
reason for
we've
the
done
lag?
about 240 out of Rikers so far of the 700 statewide, but we can get you the exact number,
That's a
Jesse.
fresh figure. And Governor, on a more kind of psychological, philosophical issue, 730 people died. These numbers keep rolling out, but it's easy, it would seem, to get numb to these sorts of, stats. How do you counter that? How do you impress on people that these are human lives, that this is an enormous human catastrophe?
You know, Jesse, if they, I hear the point. I guess one could get numb to the numbers. That's why I said, remember, every number is a human being behind that and a family. For myself, I can tell you, the last thing I do is get numb. I can tell you for the hospital staff that goes through this, they're not getting numb. For the families who are suffering, they're not getting numb. The pain is increasing. The grief is increasing. I mean, you see those pictures on TV of getting to a situation where you have to put bodies in trucks, in parking lots. I mean, how you could get numb to any of this, I can't imagine, especially New Yorkers, that we lose the humanity of this. It's something I struggle with every day. I try to think of the opposite, that, we are doing good, because you can't save everyone. This virus is very good at what it does, and it kills vulnerable people. That's what it does. And it does that very well. And we can't stop that. The question is, are you saving everyone you can save? And there the answer is yes, and I take some solace in that fact. Our healthcare system is operating. I don't believe we lost a single person because we couldn't provide care. People we lost, we couldn't save despite our best efforts. But no, I don't see the numbness, and I don't believe New Yorkers see the numbness. I think the frustration of an individual situation can cause you to do irresponsible things, to go out more than you should, to disregard social distancing. I think that's an issue, and that's what I've been trying to address.
Governor, I know we're not there yet, but when people do eventually start getting back to work, will it be the reverse of the reduction, meaning they'll go back in spurts of 25% at a time, or 12, or something like that?
I don't know. It's a good question. I think they go back, is my opinion. It's not a fact. I think, and we're working on a plan with Connecticut and New Jersey, because when we go back together. I think we go back with people who have tested that they are negative, or people who have tested that they have the antibodies, which means they had the virus and they're immune from the virus. Or we go back with younger people going first, still protecting, isolating the vulnerable. But if it's waves, I think those are the waves.
Is there any proof you can't get reinfected?
Say it again.
Is there any proof you can't get reinfected if you have the antibodies? Is there
Let's
proof
ask Dr. Zucker, your friend.
So usually when you have a virus, you develop antibodies, you don't get it again. There was one report out of China where they suggested that maybe there were some cases, but that hasn't been confirmed yet.
Are you concerned that the temporary hospitals will be accepting significant numbers of patients until after the peak is passed?
A larger number of what, I'm sorry?
Are you concerned that the temporary hospitals won't be accepting significant numbers of patients until after the peak is passed?
A significant number of patients?
Mm-hmm.
No, they're ramping up now. The Javits Center and the Comfort you're talking about? Yes. Javits and Comfort, well, there's two separate situations. when I say we have about 90,000 bed capacity, we brought online additional beds, right? Two ways. Number one, every hospital had to increase capacity by 50% with a goal of 100%. Every hospital has increased capacity 50%. That's why you see hospital beds in conference rooms and lobbies, et cetera. Second, we built temporary emergency facilities, primarily around downstate New York. They may or may not be used depending on whether or not we need the beds. The Javits and the Comfort we are using, and they're ramping up now. I'm going to go speak to the hospitals. Thank you.
Is there any plans on how to address grocery workers and their safety?
Grocery store workers, transit workers, first responders, police officers. These are all, in my opinion, heroes of today because they get up every morning, they go to work, so society stays safe and functioning. And we're doing everything we can to protect them. But we owe them a big thank you. Thank you, guys. Thank you.